So, after listening to an inspiring entrepreneur and innovator, you'll have to listen to this boring government guy. But I'll try to be brief and also tell you about some concrete initiatives that the Swedish government and this agency that I represent are actually working on to make things that you are working with happen. So my name is Daniel Forslund. I work at the Vinnova, it's called, the Swedish governmental agency for innovation systems. And I must say I have one of the greatest jobs in the world, I must say, because my responsibilities as chief strategist, I'm responsible for all our work on both to challenge society to come up with new solutions and also to work with a perfect combination of services development, ICT, and also healthcare development, and also public sector innovation, how to really boost the uptake of innovation and creative ideas in society as a whole. So I think that's a really good combination of how we can make things not only be developed, but also be used in society in a better way. Before I started at Vinnova, I also worked for almost 10 years at the Ministry of Health in Sweden, responsible for e-health solutions. And e-health, well, this is part of e-health actually, to really create new solutions for patients, for health professionals, for others to actually use information in a better way. At the ministry, my role was to say no to innovators like yourself that had crazy ideas on how to make information available for patients or for health staff or others. Now I actually can really say yes to you instead and create possibilities and challenge society to be ready for new crazy or innovative ideas, and that's a really good thing, I think. So and to aid me in that endeavor, I also have 2.2 billion Swedish kroner to actually make things happen, and that helps a lot, I can tell you. So well, I won't give that much money to you tonight, but perhaps in the long run, who knows? So. Just to give you some words why this is actually extremely important to the Swedish healthcare system, to the Swedish society, and for the Swedish government. Everything related to health is now really related to patient empowerment, to self-empowerment to the citizens that are not patients, to really create possibilities for the co-production of data, to the sharing of data between different parts of society, between different parts of healthcare, and in between individuals. Because we, as healthcare leaders in some way, we need to challenge ourselves to really create those possibilities that fulfills those political goals about patient empowerment. Because now patient empowerment is a strong political buzzword. Every party actually now in the Swedish Parliament is talking about tools for patient empowerment, but those tools are not there yet. So today this is mostly related to the political will, the words of doing something great, but we are not there yet, and you can help us actually to provide those important tools that we actually need to, well, move from paper to reality when it comes to patient empowerment. So I have big hopes for you for this weekend actually. But tools are not enough. So we are trying also to really abolish those factors actually hindering what you are doing, because there are, you know, how hard it is to actually make innovations stick in the system, to create an uptake of new ideas, of new technologies, get them used throughout the system, get them acknowledged by healthcare professionals, by citizens, create this sense of safety and comfortable use of new technologies that make people sure that, well, my data is handled in a safe way. So we are also now working on a lot of things to really make this a true and safe development in healthcare that I will explain a bit more about. Our endeavor is also to shift the focus from healthcare, not only to talk about care about people who are already fallen ill, but also to highlight the use and the need for preventive measures, for public health matters, for this self-empowerment, for living healthy, having healthy lifestyles, coaching, new knowledge on how to actually stay healthy and not ever falling ill. And many of those apps that Rajiv told us about, I have, I think, at least half of them on my iPhone, and I have a wristband logging my sleep and my how much I walk and how much I talk. Perhaps also it could be useful, but it's really something else when you can combine that data, and that's why we are really working on new initiatives on that domain. So our initiatives, I think, we are 3 main domains that we are working on, which are all really focused on your area of expertise. And the first thing, which actually creates a big challenge for you in the future, is to we now recently got we became commissioned by the government to launch a call for applications linking to the new personal health account that the government is now investing heavily in. The Swedish government has identified this area as one of the most important areas for healthcare development for the upcoming years. So they have put down almost 250 million Swedish kronor only for creating a national personal health account for every citizen in Sweden. And this means that you will all be issued a personal health account where the government now has made a procurement with a safe solution where all your medical data from your sleep cycle app or from your Runkeeper app or from every app you can know tracking your health, your health diary, whatever you want, could be stored safely in one space, which makes it's sure that this data is handled in a secure way. And this also opens up the development of entirely new services, since citizens now can be sure that, okay, this is not a company who uses my data for whatever purpose, or store it in India or California or Norway or other places in the world. It's actually stored here. You know that this is safe. You also create an environment where you have standardized methods of connecting to this personal health account from third-party apps. You can really combine and present data in a comprehensive way that makes it possible to really see that, okay, if I take my medication, I sleep better and I can run faster, and if I run more, I actually sleep even better, and I can, well, you know, really combine data from all the different sources that you can have in your daily life. So this is a really big initiative that will create entirely new growth in the services development for the health apps and both web applications and applications for smartphones and so on. So we plan to launch a call this summer focused on new applications for personal health account. We have also, as a second important measure, launched today. We opened a call for challenge innovation prizes to stimulate both public entities as our county councils, care providers, but also private organizations, perhaps a patient organization, could be a company, could be just entrepreneurs coming up with ideas, and we want to help them to actually launch a challenge prize, innovationstävling, where you can, based on the needs you have in your organization, challenge all vendors, all developers, all innovators to come up with the most brilliant idea on how to solve this challenge that you have internally in your organization. And then you get funding for both establishing this challenge and also helping to design that, and also money for the testing and implementation of that idea in society. So we're really trying to find new ways of based on the needs of society, find new ways of solving them, and also to not only stimulate the big vendors and the established companies to come up with solutions, but also open up the market, especially the public procurement part, to really reach out to the smaller companies, to startups, to innovators and people at universities and so on. So this is also an important thing that we hope very much for. That call closes on, I think, June 14th. So I also encourage you to send in an application on that call. But well, development of services is not all. So we are really also focusing on the toughest thing and perhaps the hardest part of innovation, and that is the structural changes needed for creating the uptake and use of all these smart apps that you will develop during this weekend. Because, well, in the ideal world, all these applications developed should just be used throughout the healthcare system and throughout the society. But we know that that is not so. So we have to work on a structured way to really identify and abolish all those factors hindering the use of these smart solutions. And that could be everything from the leadership in healthcare to get our local and regional politicians to understand what innovation is all about, to challenge the reimbursement systems, the structures within the healthcare system that are actually are only reimbursing the old technologies. We are still reimbursing care providers who are sending faxes or using pagers instead of smart solutions. We having just decision support on an iPad could be a dream for many health professionals in society. So we really have to see that healthcare providers or the financiers of healthcare are putting money into the most innovative and the newest technologies, not the old ones. And we also have to then challenge the way they are procuring things, because healthcare providers are really always keen on putting a lot of demands on in the procurements. You can have 700 detailed descriptions on how this new e-solution should look like if I procure from a hospital side. Perhaps that's not the best thing to stimulate, the best way to stimulate innovation. Perhaps you should challenge also in procurement to procure an innovation, to say that we are not happy with any of those solutions available on the shelf. Perhaps we can procure an innovation instead, and really get that solution that the vendors actually, that the healthcare staff actually needs, or that the patients really need. So we are really trying to also pinpoint all those hard systematic changes that are needed for healthcare change, and for that healthcare can really use what you are developing. So we are trying to create a better market for everything that is being developed here tonight, or in this weekend. So I think I'll stop there and just say that your job here is extremely important. You can really help us to shape the healthcare of the future, and to really show that this is not only crazy ideas, but we really can provide solutions that are workable, viable, and secure, and actually usable for citizens throughout the healthcare system. So I wish you good luck, and I'm looking forward to see your applications on smart solutions and financing your projects when they are mature. Thank you very much.
So, thank you very much, Daniel. I have a question about all these solutions and apps enable the patient or the person to know more about him or herself.
Mm-hmm.
And that will, I think, make a shift in kind of who has the power of your disease or your illness.
Oh, yes.
Today it's the doctor and it's the healthcare provider,
Mm-hmm.
but that will change. What's your view on that?
I think that's the main purpose of all these initiatives taken from the government, because we need to have a very strong shift of power within the healthcare system, because now we are there only on the terms of the healthcare professionals, and the system is requiring from us what to do when to show up in healthcare. If you're scheduled for an appointment for a healthcare provider, you are called there when it's suitable for the healthcare system, not for yourself. So I think all these measures will change all that, and we have to find ways of making that transition also secure for the healthcare professionals, because they are feeling a bit insecure now that we are opening up the access to your own medical data, when we are opening up access to their time logs and internal decision support systems. If patients are actually equally informed as the doctor, that requires a entirely different tone and discussion between the professional and the patient, and that is a good thing. But we have to make it as a secure transition for also the healthcare staff.
Thank you. Is there anyone out in the audience that has a question for Daniel? Okay, there is one. Great. Pass the mic.
Hi, Fredrik Skoglund is my name. I worked with packaging and industrialized a lot of solutions and services, but I also work as an investor, helping entrepreneurs a bit on advice and so on, sharing a bit of knowledge. How would you pitch Vinnova funding from the context when we talk to entrepreneurs? Sometimes we don't advise them to go for like governmental funding or European money. Go for the market, we say instead. Focus on the customer. Otherwise, you end up. And I've seen more of Vinnova's program in this. I think it's a great program. I think you're targeting a lot of the right things. But how would you, in less than 60-second pitch, why should they bother go via and try to get some funding from Vinnova?
I think the most important aspect is that if you are a Vinnova project, you also get national visibility. You get your eyes on the project, you get a thorough evaluation of the quality of a project, and you can also then create the arguments you need for selling your product or for implementing it widely in society. You can do that from by the power of a market as well. But by using a Vinnova project as a national learning experience, you can also get entirely different entries to different customers in healthcare. So I think that's the main thing I would say is why you should apply for Vinnova funding. Otherwise, the market is much better than the government, I should say. But still, we are there to take the risk that the market cannot take. So, lights out.
Lights out. Yeah, it's a timer, I think. We'll put it on. Okay, do we have any other questions for Daniel? Okay, thank you very much. Thank you very much for joining us.